Hello students, start the session. Hi everyone, I am Dr. Murugan, your PSM faculty. We have this session on FMGE Spotlight for the upcoming exam uh, January 20th. Okay, fine. So we'll quickly go through the topics. Okay, so hope I'm audible. Am I audible? Fine. So we'll quickly go through the session first. First question. This topic, the question is on, we'll chapter wise we'll go, some 25 important topics we are seeing, and whatever contents related with the topic we will go through it. 18-month-old unimmunized child coming to hospital for the first time, what are the vaccines to be given? Okay? This is a scenario based question. Okay, so to understand this question, we have to know the national immunization schedule. We have to know national immunization schedule. First, let us start with the national immunization schedule. Right. Okay, so what are the vaccines given at birth? We'll come back to the question. What are the vaccines given at birth? The vaccine that is given at birth is, okay, yes, anyone? Yes, BCG. BCG we are giving. Okay, OPV 0 dose we are giving. And we are giving hepatitis B. Okay, so these are the vaccines at given. Okay, hepatitis B has to be given within 24 hours. At 6 weeks, what are the vaccines we provide? Yes, okay, OPV1, pentavalent 1, we have this rota 1. Then what else we provide? Yes, we also provide vaccines of IPV1 and PCV1 first dose. In pneumococcal vaccine we provide. And 10 weeks we provide OPV, penta and rota. We don't provide IPV and PCV. Okay, so this is second dose. At 14 weeks we provide OPV3, penta 3, rota 3, and IPV give 2 doses, and we provide PCV 2 doses. Okay, that is 6 and 14 weeks we provide. What about 9 months? At 9 months we will provide MR1, AE1. Now we are giving IPV also, a booster dose will provide, PCV as well as vitamin A. So these are the vaccines we provided. 9 completed months we are going to provide. 16 to 24 months, what we are going to provide? MR2, AE2, OPV will provide booster, and as well as we will provide DPT booster will provide. 5 completed years, what we will provide? Will provide DPT. 5 completed years will provide DPT. 10 years, 16 years in pregnancy will provide this DT vaccine, that is diphtheria and low doses, as well as tetanus. Okay, so these are the vaccines we provide in the national immunization schedule. Now we will come back to the question. Okay, what does the question says? The question talks about when the 18-month-old baby. So there are certain vaccines you should not give more than 1 year of age. What are the vaccines not to be given more than 1 year of age? Okay, BCG, IPV, hepatitis B, pentavalent, rota and PCV. So these are the vaccines not to be given more than 1 year of age. Not to be given more than 1 year of age. Now what about vaccine 5 years? Okay, 5 years. So we should not give certain vaccines beyond 5 years. MR, OPV and vitamin A. They should not give beyond 5 years of age. Okay, fine. What about vaccine up to 7 years? You can provide DPT up to 7 years of age, DPT. and up to 15 years of age we can provide a JE vaccine. So this is a scenario based question, and now you'll go back to the question, you answer the question here. Okay, fine. Yeah. Now tell me, this is an 18 months old baby. So what are the vaccines to be given? Unimmunized, and they're coming for the first time. What are the vaccines to be given? What are the vaccines we have to give? Yes. So the first option we have BCG, Penta. So this is not applicable. BCG, hepatitis B, again IPV. So the right answer here is option D. Okay, fine. So this is 18 months. 18 months. So what are the additional points? What are the additional points we should know here? Additional points we should. Okay. Yes. Yes. Correct only. Hepatitis B we cannot. Okay, that is at birth. Fine. Now, what is cold chain? What is the temperature of cold chain, guys? Yes, temperature of cold chain is that we should maintain +2 to +8 degrees Celsius. Ideally +2 to +8 degrees. Next exam question. Where will you store the vaccines? In a PHC. PHC, you have to store vaccines only in ILR. ILR means ice-lined refrigerator. PHC is only ILR. Fine. Vaccine carrier. Next question. How many vaccines you can store? Vaccine carrier, 16 to 20 vials. You can store 16 to 20 vials in vaccine carrier. Now, what about open vial policy? What do you mean by open vial policy? Normally, vaccine should be used once opened. Once open, it has to be used within 4 hours. What are the vaccines? It has to be used within 4 hours means BCG, MR and JE. These 4 vaccines, once open, it should be used within 4 hours. Remaining all the vaccines, whatever we have discussed under open vial policy, remaining all vaccines can be used for 4 weeks. Whatever the remaining vaccines we have seen, that can be used for 4 weeks. Okay, fine. So normally BCG, MR, JE, they have to be used within 4 hours. If MR vaccine used more than 4 hours, what it can cause? Used more than 4 hours, it can cause TSS, toxic shock syndrome. So what is the test available to know whether vaccine is frozen vaccine? For frozen vaccine, the test available is shake test. Shake test. Okay, fine. Okay, so to identify whether this vaccine is exposed to heat or not, what we are going to use? Yes, we are going to use VVM, guys. VVM, vaccine vial monitor. Which stage to use it? Stage 1 and 2 use it. Stage 1 and 2 use it. Stage 3 and 4 you have to discard. Quick revision, guys. Stage 3 and 4 you have to discard. Stage 1 and 2 you can use it. This is cold chain and this is open vial policy. We'll go to the next questions, guys. Next question. All of the following are examples of specific protection except. So this is a topic question from concept of health and disease. Okay, you had questions from this. So we'll come back to this question. Okay, so specific protection, we'll come back to this question. First, let us learn about prevention. Okay, so you had a question in last July session also, we had one question. Okay, fine. So what are the different levels of prevention? The first one we will start with. What is prevention before risk factors? Prevention before risk factors, this is called as primordial prevention. Before risk factors itself, we are doing prevention. What is prevention before disease? That is, risk factors may be present, but disease is not there. So prevention before disease is, so this is called as primary prevention. You are doing prevention before the onset of disease. This is primary prevention. Yes, Dr. Sarin. Okay, fine. What is the next one? Action that halts the progression. What do you mean by action that halts the progression? Yes, action that halts the progression. What is it? That means disease have started. You are trying to stop it at an early stage. Okay, yes, this is called as secondary prevention. Disease have started and you are trying to stop it at an early stage. That is secondary prevention. What is tertiary prevention? Tertiary prevention, measures taken to reduce disabilities. Just keep it in mind. Anything, okay, further complications we want to reduce it. Measures taken to reduce disability. So before risk factors, और रिस्क फैक्टर का पहले अब जो भी करना है इसको बोलते हैं प्राइमोडियल प्रिवेंशन. तो रिस्क फैक्टर है बट डिजीज इज नॉट देयर. ओके, तो डिजीज आने के पहले आप जो भी कर रहे हैं उसके लिए उसको क्या बोलते हैं? प्राइमरी प्रिवेंशन. डिजीज आ गया तो फर्दर कॉम्प्लिकेशन नहीं होना चाहिए, सो वी आर गोइंग टू डू इट. दैट इज सेकेंडरी प्रिवेंशन. दैट इज एक्शन दैट halts the progression. Tertiary prevention is fine. Now how we are going to achieve this? This can be achieved by some interventions. So we have 5 modes of interventions are there. The first one, health promotion and specific protection. This comes primary prevention. This focus on primary prevention. And secondary prevention is early diagnosis and treatment. These two comes in tertiary prevention. Disability limitation and rehabilitation. So you had a question this time also. You had a question. Okay, tobacco control law last time. Okay, it's an example for what? So you are passing a law to prevent the consumption of tobacco. So you are doing it beforehand. Okay, that comes in primary prevention. Okay, fine. Yes. The health promotion, how you are going to do? You go there and teach health education. You are going to do. Okay, lifestyle modification. So no smoking, no alcohol, like that. Lifestyle modification. Avoidance of water stagnation, that is environmental modification. So all are examples for health promotion, and that is an example for this primary prevention, health promotion. Okay, so second, specific protection. You are doing specific protection. Specific protection is what? You are doing something very specific. Yes, vaccination. Okay, vaccination, that is an example for specific protection. So next we have vaccination, we have seen. Next we have this condom. Condom is again an example here. Condom is again an example for specific protection. Okay, so all these comes in primary prevention. Okay, so the question that was asked is, I think tobacco control law. Okay, fine. So hand washing. Okay, so in nosocomial infections, you are washing hands, okay, before seeing every patient. That is also an example for primary prevention. Okay, don't say primordial because we do have risk factors we have, so that's why we wash hands. Early diagnosis and treatment. Okay, anything you search for cases. BP monitoring, pap smear. Okay, pap smear. Okay, all these things comes in what level? Secondary prevention. You are trying to find the case here. So disability limitation, that is okay. Disability limitation, it comes like this. Disease will be there. Disease will lead to impairment, disability, and finally it go for handicap. Okay, fine. But in your past 2 exams, the question was focusing these areas. Okay, health promotion, specific protection, early diagnosis and treatment, guys. So we'll go to the question and now tell me what is the answer for this question. What is the answer for this question? All of the following are examples of specific protection except. So specific protection except, what will be the answer here? So chemoprophylaxis, specific protection. Condom, specific protection. Iodization of salt is again specific protection. So what is this answer? Personal hygiene and environmental sanitation. That comes in what? Health promotion, not specific protection. We'll go to the next question. Years of life lost indicates. Years of life lost. So years of life lost, this indicates actually years of lost due to premature death. This is a need question actually. So years of life lost due to premature death. So this concept, where we should know this concept. So we should know in terms of what is DALY and what is HALE. First is DALY. DALY means Disability adjusted life year includes two things: years of life lost plus years of life lived with disability. Just watch it, guys. We will send this PDF to you. Okay, years of life lost and years of life lived with disability, two things. So this life lost indicates premature death. This is what the question. Okay, so it indicates both, guys. Okay, so how much premature death as well as how many years the person lived with disability. So DALI indicates what? DALI indicates disease burden. Okay, one DALI is equal to 1 year of healthy life lost. 1 year healthy life lost. This is called as DALI. So one DALI corresponds to 1 year of healthy life lost. Next, what is HALE? HALE means what? Okay, HALE, health adjusted life expectancy. HALE, health adjusted life expectancy. So this is number of years of life added by intervention. How many extra years the person was able to live? How many extra years the person was able to live? This is called as HALE. HALE. We call this as HALE. So a person without treatment, okay, he lives for a person is having cancer, okay, so without treatment he dies at 60 years. Okay, with treatment he dies at 70 years. So how many extra years the person was able to live? So the person was able to live 10 more years more. That we call it as HALE, health adjusted life expectancy. Two more indicators we will see. Okay, one is called as, what is this one corresponds to what? Anyone, can you answer this? Life expectancy at birth, per capita income, knowledge. Okay, this includes what? What does this say? Yes, this is HDI, Human Development Index. So the scale is for this is 0 to 1. So what is measured? It measures the quality of life. Okay, any countries, to measure the quality of life between countries. Okay, India, Pakistan, UK, US, like that we can do it. Any country is less than 0.55 means low HDA country. Low HDA. 0.56 to 0.69 medium. India comes in medium actually. Okay, 0.7 to 0.79 high HDA countries, and more than 0.8 very high HDA countries. Okay, so India comes where? India comes in medium HDA countries. Okay, fine. For these indicators, we use this life expectancy at birth. So which country is taken as standards? Yes. So for life expectancy, it is Japan. Okay, that country is taken as standards. What about this one? Life expectancy at 1 year, IMR literacy rate. Yes, this is called as PQLI. Okay, this measures PQLI. What is PQLI? PQLI means physical quality of life index. Physical quality of life index, PQLI. The scale is between 0 to 100. This also measures quality of life. Okay. So you can take it for Maharashtra, okay, Madhya Pradesh, Uttar Pradesh, Bihar, Tamil Nadu, Kerala, like that we can calculate this. Quality of life. Go to the next question. What is the vaccine protocol after a disaster? So we'll come back to this question. So this topics corresponds to disaster management. What does it say? Following a disaster, suppose earthquake is there, cyclone is there, okay. So what is the vaccine protocol after that? So first, in this last exam also this question was asked, triage. So what about triage? What are the key points here in this disaster management? Triage should be done at the site of disaster. Triage should be done at site of disaster. Okay, fine. Okay, what we should do? Okay, so in this site of disaster, the high priority. So we are going to do color coding. We are going to do the high priority. किसके लिए करना है? High priority means red. Okay, they have to be treated emergency. Okay, emergency. So medium priority is yellow, stable patients. We can wait actually for some. Ambulatory means it is green color. Moribund means it is actually dead color. High priority, the person is high priority means red. I think in your last exam, July exam, this question was asked. Okay, yellow color we have to give for stable people. Fine. So following disaster, what is the most common outbreaks you can see? Following disaster, the most common outbreaks kya hai? So that is AGE, guys. AGE means acute gastroenteritis. That is the most common outbreak. So in following disaster, जो भी disaster उसके बाद क्या नहीं करना है, that is we should not do no mass vaccination, no mass chemoprophylaxis. Don't go for mass vaccination, mass chemoprophylaxis. So any additional vaccines, the priority is healthcare workers. Healthcare workers is the priority. Any additional vaccines. So if you want to give any additional extra vaccine you want to give, so focus on healthcare workers. What we should do? Okay, so following disaster, we should concentrate on safe water, sanitation. Suppose the floods are there recently. Okay? So floods, cyclones, okay, earthquake. Okay, so whatever the disaster, should focus on providing safe water and sanitation. Now, disaster responsibility. Whose responsibility is disaster? Suppose a disaster happening someplace. Is it the responsibility of state government or central government? Disaster responsibility is primarily state government. State government. Ministry of Home Affairs will coordinate. They will assist the state government. Ministry of Home Affairs. They will coordinate actually. Nodal center for disaster. Where is the nodal center? Okay, the norms say that nodal center for disaster should be located at district level. At every district we should have a nodal center for disaster we should have. And we have this NDMA, National Disaster Management Authority. So who is the chairperson for it? Yes, it is the Prime Minister. Prime Minister is considered as the chairperson. Okay, National Disaster Management Authority. Okay, fine. These are some of the key points we should know regarding this question. Now we'll go back to the question and tell me what is the answer here. Vaccine protocol to be followed after disaster. What is the vaccine protocol? So everyone to give diphtheria, this is wrong. Everyone, there is no need for mass vaccination, mass chemoprophylaxis, cholera vaccine, no. So we are going to provide only healthcare workers given cholera, typhoid or any extra vaccine we are going to provide for healthcare workers. Right. Okay. This is what is the norms. We'll go to the next question. Average number of girl children born to a woman if she experiences current fertility pattern assuming no mortality. This is an important topic as far as this demography is concerned. You are getting maximum number of questions from demography in each exam, what I am seeing. So this is the definition. You are trying to predict average number of girl children if she experiences current fertility, no mortality. This we call it as gross reproductive rate. This is called as gross reproductive. The average number of girl children. Better one. Net reproductive rate. Okay, net reproductive rate, we call this as NRR. So what is NRR? NRR is same thing. Okay. Number of girl children born to a woman based on current fertility and mortality. You are trying to predict fertility and mortality. You are taking both into consideration. So you are taking both into consideration, then it becomes NR. You are trying to predict. Suppose a woman is there. Okay, a woman will have how many girl children based on current fertility and mortality. If mortality is included, then it becomes NRR. What is our target? Our target of NRR is equal to 1. Net reproductive rate should be 1. That means every female should have a daughter, girl child. Okay. To achieve this NRR of 1, we require couple protection rate should be 60%. Means 60% of couples should be protected against some contraception they should use. 60% of couples. This is what the meaning is. Fine. So recently asked 2 more indicators we will see here. The next one is what is TFR. What is TFR? TFR means average number of children born to a woman. Average number of children born to a woman. What is the average number of children born to a woman? How many children a woman will have? That we call it as TFR. What is our target? Target is 2.1. 2.1, which India has achieved actually. TFR target is 2.1. That means 2 child now. India has achieved this TFR, average number of children born to women. July exam. A general fertility rate, GFR, general fertility rate. This is number of live births by a particular year by women in reproductive age group. Reproductive age multiplied by 100. This is what the question is in your last exam. So number of live births by women in reproductive age group. This is general fertility rate. So you may ask, what is the formula for crude birth rate? CBR, crude birth rate. Crude birth rate is the number of live births by mid-year population multiplied by 1000. MYP means mid-year population. Mid-year population corresponds to which date? Yes, mid-year population corresponds to, this corresponds to 1st of July. So this was also been asked in your exams. 1st of July. Crude birth rate, number of live births by mid-year population. This was your last exam question. Live births by women in the reproductive age group. Some additional points we can see. Fine. How many stages are there in demographic cycle? Demographic cycle. So we have 5 stages are there. 5 stages are there. So India is in which stage? India is currently in late expanding stage. India is currently in late expanding stage. Fine. Whom do you call as literate? Literate means persons more than equal to or more than 7 years who can read and write. They are called as literate. More than 7 years. More than 7 years who can able to read and write. Whom do you call as eligible couples? Eligible couple. Currently married couples. Currently married couples with wife is there in the reproductive age group. Reproductive age. They are eligible couples. I think in your last exam this question was asked, where will you maintain this eligible couple register? We have this eligible couple register. This will be maintained at the sub-center. Currently married couples were wife in the reproductive age group. Eligible couple register will be there in the sub-center level. And the female health worker, she will maintain it. So have we seen the answers? Yes, we have seen the answer for that question. Next question. What are the side effects of these oral contraceptive pills? We have these OC pills. Except the question was except. So OC pills, we have what we have OC pills? Mala D and Mala E. Mala N is free of cost. Composition wise, both are same. Levonorgestrel will be there. Ethinyl estradiol will be there. So Mala Mala D comes in social marketing scheme. Mala D comes in social marketing scheme. It comes in the tablet what we have is should have is levonorgestrel and ethinyl estradiol. It should have ethinyl estradiol. Composition wise it is same. So what is the mechanism of action? Its mechanism is that it causes prevents ovulation. It prevents ovulation. It prevents ovulation. It prevents. So what are the side effects that will happen? Weight gain will be there. Breast discomfort will be there. Deep vein thrombosis. Okay. The answer for this question is ovarian malignancy. What else it can cause? It can cause myocardial infarction. It can cause. Okay. Second, it can cause hepatic adenoma. Hepatic adenoma. It can cause cholestatic jaundice. It can. These are some of the side effects. Side effects of this OC pills. Now, we have a non-steroidal oral contraceptive pills available. In non-steroidal, it's called as 𝐒𝐄𝐝. Okay, it's called 𝐒𝐿, guys. This is 𝐒𝐿. Is given in the program under the name of 𝐒𝐄𝐝, non-steroidal oral contraceptive pill. Non-steroidal OC pills is given. What is the chemical it contains? The chemical that contains is called as or-meloxy. This is the chemical that is given. 𝐒𝐄𝐝, this is given. The program we are giving it. In program, what else we provide? We also provide Antara. So it is DMPA injection. Depot medroxyprogesterone injection. DMPA injection is given Antara. Antara we provide. For emergency contraception, we are providing easy pill. Levonorgestrel pill, 0.75 milligram. 2 tablets they are providing. Government, this is given. Okay, so easy pill, we are providing easy pill. And we also have this 𝐒𝐿. What is 𝐒𝐿? 𝐒𝐿 is home-based pregnancy test kit. Okay, we are having this pregnancy test kit. This is 𝐒𝐿. 𝐒𝐿 we are giving. What about IUCD? IUCD, what we use is 380A or copper T375. These are the two copper Ts we use in the program. So 380 means what? Surface area of copper. How much copper is there? Surface area in square millimeter on the device. Now, so 380A, how long it can be used? This can be used for 10 years. This can be used for 5 years. Okay, 5 years. So what is the mechanism of action? So it prevents implantation, foreign body reaction, prevents implantation. It prevents implantation. That is one of the important mechanism of action. So it prevents implantation. Copper T380. So what is the chemical that is present there that shows the visibility to see in X-rays? Yes, what is the chemical? Yes, radio opaque material. Yes, it contains barium sulfate. Barium sulfate, that is a chemical that is present. So that is the reason visibility in X-rays can be maintained. So these are the points we should know, guys, regarding this OC pills as well as IUCD. So how will you measure the contraceptive failures? Contraceptive failure, this is measured by Pearl index. Pearl index measure the contraceptive failures it can measure. Okay, recently asked question. What about vasectomy? Okay, following vasectomy, the person is not immediately sterile. Okay, so what advice you will provide? Okay, so use other methods. Use other methods. For how long? It has to be used for 12 weeks or 30 ejaculation. 12 weeks also 30 ejaculation. Okay, fine. This was the question. I think this recently in July exam, this was the question. So 12 weeks they should use some other methods of contraceptive or 30 ejaculation. This is contraceptive failure rate. This is measured by Pearl index. Pearl index. Next question. Blood bags are discarded in which color bin? Okay, come on, anyone, can you answer? Blood bags. It's a biomedical waste. Okay, we have these 4 color coded bins. We have red, yellow, blue, black. Okay, so blood bags should be discarded. Okay, one of you can answer. Yes. Yes, you can answer it, guys. Now, so we'll come back to this question. Now, these are the various waste that can be generated. Now, first is anatomical waste. Okay, anatomical waste. Okay, so you are doing a surgery. Okay, so or you are doing an amputation. Okay. Yes, yes, Umar Vani. Yes, that is yellow. Fine, excellent. Okay. So you are doing a surgery. Okay, so you are doing amputation, and you are delivering a placenta. Okay, it should go to yellow color bin. Animal waste. Okay, fine. Soiled waste. Soiled waste is that also should go to. So gauze piece is there. That gauze piece soaked with blood or pus. Chemical waste, liquid chemical waste, expired medicines. Okay, recently asked question. Okay, in your exam, expired medicines was recently asked. Okay, expired medicine should go to, all these should go to microbiology waste. In microbiology waste, you will have blood bags. So all these waste should go to which color bin? Can anyone tell me? So all these waste should go to yellow color bin. Should go to yellow color bin. So after yellow color bin, facilities are available. It should go for incineration. I think that was the question. Okay, it's discarded medicines. Okay, so vaccine containers, if you have with vaccine, okay, that means with live vaccines are there. That means vials with live vaccines are there, means it should go to yellow color bin. But if it's already used one, there is no vials, the vials not having any vaccines or something, that should go for broken ampules are well, that goes to blue color bin. Now, urinary bags, catheters, whatever that is the recyclable waste. The recyclable waste, rubbers, tubes, plastics, syringes, they should go to red color bin. Red. After disinfection, okay, it should red color bin. After disinfection, they can go for recycling. They can go. Gloves. So gloves is there. Okay, gloves should go to that is whether it is soaked with blood or red. Okay, it should go to red color bin. Okay, fine. The next, okay, waste shops. Okay, blades and needles. Blades and needles, they should go to, is which color bin? Yes, they should go to white color bin. Okay, white color bin. Broken ampules or vials, metallic body implants. Okay, metallic body implants. Okay, they should go to which color bin? Yeah, they should go to blue color bin. The recently asked question. Okay, what about this one? That is pacemaker. Pacemaker should go to which color bin? Is anyone? Can you tell me? Okay, so pacemaker should go to which color bin? So pacemaker is actually metallic body implant. Okay, pacemaker. Okay, pacemaker is metallic body implant. It should go to blue color bin. Blue color bin. Okay, fine. So answer for this question is blood bags should go to yellow, guys. Blood bags should go to yellow color bin. Now, so what is incineration? Key points here. Additionally, incineration. Incineration means high temperature dry oxidation process. Okay, so whatever waste, okay, that will go for like this. Okay, so infectious waste, you are going to make it as inorganic waste. High temperature dry oxidation process. What is inertization? Inertization, we use it for pharmaceutical waste. Pharmaceutical waste is, okay, that is mixed with cement and lime, okay, plus water, and it can go for deep burial. Can go for deep burial, that we call it as inertization. That will not affect the what, that it will not affect the subsoil water. Okay, so especially drugs are there, expired medicines we have, and you don't have facilities for incineration. This way we can do it. We'll go to the program chapter. Next question related with programs. All are true about RBSK. Again, we are recently having questions related with these programs. Okay, so first is, what is RBSK? This is Rashtriya Bal Swasthya Karyakram. So RBSK. So this is correct. It started in the year 2013, and it involves child health screening and early intervention. That is also correct. 0 to 18 years. That is also correct. For children less than 6 weeks, screening is done by Anganwadi workers. No, this is done by ASHA. Okay, so what they will do here? So what they will do? So they will look for 4 Ds. Defects at birth, deficiency disorders, developmental delay, and disease. 4 Ds you will look for. Okay, defects, deficiency disorders, developmental delay, and disease. Who is responsible for this is, okay, RBSK, primary health center is the responsible. Okay, PHC. Okay, it is the responsibility of PHC, primary health center. So they will be the responsible for this. So defects at birth, deficiency disorders, developmental delay, and diseases. So at 0 to 6 weeks, ASHA will do the screening. Okay, ASHA will be going at home-based newborn care, HBNC. ASHA will be going home-based newborn care. 6 visits she will be making. So during the visits, ASHA will be checking whether the baby is having any of this. Similarly, ASHA will be also doing one more thing called as home-based care for young children, HBYC. She will be making 5 visits. Okay, the first one is home-based newborn care. The second one is home-based care for young children. ASHA will be making 5 visits. She will be making. Now, some other program component we will see here. Anemia Mukt Bharat. This Anemia Mukt Bharat includes this 6x6 matrix. So we have 6 beneficiaries, 6 interventions in your last exam question, and 6 institutional mechanisms. 6 institutional mechanisms. This Anemia Mukt Bharat. So Anemia Mukt Bharat, what we are doing? We are giving tablets. Okay, so to reduce iron deficiency anemia. So this is an example for primary prevention. Okay, we are doing it. So who are all the beneficiaries? Okay, beneficiaries are between 6 months to 6 years. This is one group. 5 years. 5 to 9 years is another group. 10 to 19 years adolescent age group. Pregnancy, lactation, and women in reproductive age group. So these are 6 beneficiaries. Okay, so till 5 years, 5 to 9 years, 10 to 19 years. P and L means pregnancy and lactation group, and women in reproductive age group. So what we are doing actually, so 2 mechanisms what we do is here is, one is that we are providing IFA, iron folic acid we are giving. Yeah, iron folic acid. And second, 2 questions came from this. Second, we'll be doing deworming also will be doing. Even for pregnant women, we'll be doing. So there are some other interventions are there, but the important one is this. Iron and folic acid you are giving, as well as deworming with albendazole. Albendazole we are giving. This is Anemia Mukt Bharat. I think both are questions. Okay, this one is also a question. This concept was also a question in the last exam. What about JSY, Janani Suraksha Yojana? Janani Suraksha Yojana, who is the beneficiary here? 100% centrally sponsored program. 100% centrally sponsored, guys. What is the purpose of this program? Okay, the purpose of this program is for institutional delivery. Cash incentive for mother. Cash incentive for institutional delivery. So you are telling the mother, you come and deliver in the hospital, we will pay you money. It started in the year 2005, it was started. The institution deliveries has improved over a period of time. So what we do here? So under this program, they first introduce the worker called as ASHA. What is the criteria? Multiple times asked question. ASHA should be given what they should be given. ASHA should be 1,000 population. ASHA will be selected. She should be resident of the village. 25 to 45 years. Okay, she should be studied up to 10th standard. Should be married, widowed, or divorced. Okay, these are some of the criteria for ASHA. And so multiple times asked. She should be good in communicative skills, and her job is to make sure that institutional delivery happens. She has to accompany the mother during delivery. Okay, fine. Hope this is going well. Okay, fine. Yes. Next program. What is JSSK? Janani Sishu Suraksha Karyakram. Okay, this program is launched so that pregnant mothers and sick infants, okay, they'll be providing everything free, guys. Okay, free treatment, free lab, free blood, everything you're providing free of cost to these people. Okay, free treatment, free lab, when you're providing free blood, you are providing, okay, free transport. Okay, free transport, this we call it as, okay, so Janani Sishu Suraksha Karyakram. Okay, fine. Next is NSSK. Okay, NSSK. NSSK, what is Navjat Sishu Suraksha Karyakram? So what we do in this program, okay, this is for training healthcare workers. So under this program, you're training health workers, including medical officers, to train health workers in managing what condition is for basic newborn care and resuscitation. So this is given for basic newborn care and resuscitation. Okay, fine. This is NSSK. Now just Sishu Suraksha Karyakram. IMNCA. Okay, so IMNCA, health workers, they are trained in managing children. Training was given. Children between 0 to 5 years, any sick child is there. So they are trained for this sick child, identify this sick child, and you are going to categorize them into three things. Okay, it may be home management. Okay, home management, OPD management, pre-referral treatment, and referral. Okay, fine. Now, so we are going to use color coding. Okay, that is exam that they will ask in the exam. So home management, it has to be green color coding we have to follow. OPD means yellow, and pre-referral treatment and referral is pink color coding we have to follow. Okay, fine. This is IMNCA. Okay, so you are training health workers at the community level managing a sick child. So whenever the sick child is coming, so you have to check whether they are having basic criteria. For pneumonia, no diarrhea, we can see it. No pneumonia, severe or very severe pneumonia. For diarrhea, we can do like this. No dehydration, some dehydration, severe dehydration. The color coding we have to follow. Program launched for providing free antenatal care on fixed days of month. What is this called as? So this program is called as, okay, so free antenatal. This answer here is PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan. What is this Lakshya? Lakshya is labor room quality initiative. All the labor room in the country, we have to maintain some standards. Okay, so that is done by a concept called as Lakshya, labor room quality initiative. What is this Ayushman Bharat? Okay, Ayushman Bharat. Okay, so under Ayushman Bharat, we have this Pradhan Mantri Jan Arogya Yojana. Under this, we want to provide PMJ. We call this PMJ. So in that, we have to provide health insurance. So health insurance is given for the people. Okay, health insurance, there are certain norms are there. So they provide coverage of 5 lakhs per family per year. Okay, 5 lakhs per family per year. That is health insurance. This is Ayushman Bharat. All members are included, even pre-existing diseases are included under. Next we have what we have is what is called as Ujawala scheme. A Ujawala. A Ujawala scheme is prevention of women and child trafficking. Prevention of women and child trafficking. This is Ujawala scheme. So Ayushman Bharat we have seen, and we have seen what is Ujawala scheme. Ujawala scheme. Okay, fine. Next is what are the components of RCH? I think this was also asked in the last exam. RCH component we have is mother, child, family planning, and fourth one is treatment of STD. Okay, treatment of STDs. So for mother component we have this emergency obstetric care, essential obstetric care. Okay, so that will be there. So under this essential emergency obstetric care, this question is multiple times asked. What is FRUs? First referral unit. To call it as first referral unit, OT should be there, blood bank should be there. Okay, OT, blood bank, and we should have anesthesia facilities. Okay, if these facilities are there, means we are going to call it as FRUs. It should be located at sub-district level. Sub-district level, and we should have at CHC level. CHC hospital. Okay, CHC means community health center. Sub-center hospital, sub-center, sub-district hospitals, and community health centers we should have it. Okay, this is about RCH. Okay, I think we both have this question. This was also asked previous exams. This was also asked first referral unit. What about National Urban Health Mission? NRHM, NUHM. NRHM, National Rural Health Mission, started in the year 2005. NUHM 2013. That is correct. Second. So for every 10,000 population, one ANM should be there. That is also right. Urban CHC will be there for every 50,000 5 lakh population metros. This is also right. And this is 50,000. So any towns or cities with having a population of more than 50,000, okay, they have to follow the norms of NUHM. It comes under NUHM. So they have certain urban health infrastructure was there. Previously rural area. Now urban area we have some infrastructure. Okay, fine. Now what is the infrastructure we will see? Rural health infrastructure. Okay, fine. First we should have for every 5,000 population we should have sub-center, normal areas. Okay, in hilly areas for every 3,000 population. If it is hilly areas, every 3,000 population sub-center will be there. The sub-center, these are two types of sub-center. Type A. Type A, no deliveries. No deliveries. Type B, one deliveries will occur. Deliveries will occur. So who will be there in the sub-center? In sub-center, you will have one male health worker, one female health worker. Okay, ANM, that is auxiliary nurse midwife, female health worker, and have is male health worker. The other two people will be there. So next, above that, what we have is called as PHC, primary health center. This is sub-center. This is PHC, primary health center. PHC normally 30,000. 20,000 hilly areas. We have these two types. Last exam this was as type A, less than 20 deliveries per month. Type B, more than 20 deliveries per month. Type B. This is PHC. This is PHC. Under PHC you will have 6 beds. You will have every PHC you will have 6. You remember like this. Okay, 6 beds. And you will have also 6 sub-center under this, sub-center. So above PHC, what you have is CHC, community health center. So 80,000 to 1.2 lakh population will be there. 30 beds we have, 30 beds. Now what we have is 30 beds will have. So and we have specialist will be the specialist. So 4 PHCs it will come under 4 PHCs. Above CHC, what we have is district hospital or sub-district hospitals we will have. This is the health infrastructure in the rural areas. Rural areas. Okay. Recently, in your exam, these questions have been asked. And what about urban areas? Urban areas over a period of time. Okay, so infrastructure developed. They said that okay, we should have. So we should have for every 1,000 to 2,500 population, one ASHA. Rural areas it is 1,000 population. For 10,000 population, one ANM. One ANM should be there. Okay. 50,000 to 60,000 population, we have one PHC should be there, and 2.5 lakhs, 5 lakhs in metros. Okay, we should have one CHC, community health center should be community health center. Okay, so what is this? Which one is not present in the urban health infrastructure? Can you tell me among this which one is not present? Yes, so you don't have no sub centers. Okay, no sub centers. Okay, no sub centers. No. So under Ayushman Bharat in urban area, they want to create under Ayushman Bharat. So they want to create health and wellness centers in urban area. So health and wellness centers, rural area, they want to convert the existing sub centers and PHCs. So here the health and wellness centers. Health and wellness centers. Okay, in rural urban area for every 15,000 population they want to create where there should be one doctor should be there. Okay, so health and wellness centers, and they also wanted to create polyclinics. Actually polyclinics they want to create for every 2.5 lakh population they want to create with specialists. Okay, fine. So under Ayushman Bharat in urban areas they want to develop. So recently asked question in your exam is subcenter is not present in urban health infrastructure, and as well as what else here? Type A, type B. Type A PHC means less than 20 deliveries per month. Next question. SDG goal, I think this was also your exam question. MMR should be how much? Okay, so according to SDGs, SDG starts from 2016 to 2030. All the countries in the world have to achieve certain goals. Okay, so even India is also signatory of this. So MMR should be less than 70. The last exam question. Okay, how much should be this neonatal mortality rate? Neonatal mortality rate should be less than 12 per 1,000. Okay, and under 5 mortality rate. Okay, that should be less than 25 per 1,000 live birth. So neonatal mortality rate should be less than 12. Under 5 should be less than 25 case, 25 per 1,000 live births. So India is also signatory of this. Okay, fine. So to achieve this SDG in India, so what is the mechanism we created? Anyone can you tell me? What is the mechanism? Yes, the mechanism we created institution Niti Aayog. What is full form of Niti Aayog? One of you can say. That was also asked in your exam. Niti Aayog. What is Niti Aayog? Yes, National Institution for Transforming India. Niti Aayog. Niti Aayog means National Institution for Transforming India. Actually, it replaced what? Niti Aayog replaced something. It replaced. Yes, it replaced Planning Commission. Replaced Planning Commission. Niti Aayog replaced something. What it has replaced? It has replaced the Planning Commission. It has replaced. So we completed programs. We completed. Okay, fine. Yes. Next question. All are true about group discussion. This is the topic on health communication. We recently also had a question on this. All are true about group discussion. So we'll go one by one. Okay, so it allow free exchange of ideas and opinions. That is correct. It can change in health attitude and behavior. 6 to 12 members will sit and discuss. Okay, and it's wrong. It's an effective method of health communication. So in this group discussion, you will have, who will have, is the group discussion, you will have a leader, you will have a note taker, okay, timekeeper will be there, and so one of the very effective method of health communication. So 6 to 12 people, they will sit and they will discuss, okay, so the ideas, exchange of ideas will be there. It's a very effective method. Now, so what are some of the other methods of health communication? Demonstration. So when will you use demonstration? Demonstration, whenever you want to teach a skill. So you want to teach a skill to the people, then you can use demonstration. How to prepare ORS. I think this was the question was there. Okay, ORS preparation. Okay, ORS preparation. You want to teach something to people, then rather than taking a lecture, it's better to do demonstrate it. What about panel discussion? Okay, 4 to 8 experts, they will sit and discuss. So as an audience, you can raise questions. Okay, they will discuss. As an audience, you can raise questions to them and they will answer it. Okay, that is panel discussion. What is symposium? What is symposium? Symposium means series of lectures by experts. Experts will come and discuss. On one person will talk on etiology, other person will talk on clinical features, other person will talk on diagnosis. Okay, like that series of lectures. They won't discuss among themselves the stage. Okay, but each person will discuss. We can raise questions to. Okay, what is workshop? Workshop means hands-on training. Okay, BLS workshop. BLS workshop. Okay, future workshop. Okay, role play. Role play. When will you use role play? So whenever you are seeing a sensitive topics, a sensitive topic, children or audience, okay, then you can think about role play, guys. Role play. Okay, fine. So this is about certain methods of communication, health communication. What is this spikes is what? Spikes is a method we use to teach students, okay, especially undergraduate students. Spikes is a method we use it. This is an acronym to teach, okay, breaking bad news. Okay, breaking bad news. Breaking bad news. You want to tell to the patient, okay, so he's sick, a relative you want to talk, how to say that? That is spikes. Now, regulatory approach, these are the 4 methods we use it for approaches for health education. Approaches for health education. Okay, first is regulatory approach, a service approach. Regulatory means you are forcing people to do it, even though it's a good thing. Service approach is there. The recently asked question is, among these 4 approaches, which is the best one? Okay, so this is best one. Okay, primary care approach, planning for themselves. Planning for themselves. Okay, this is the best approach. Okay, we have a committee is there under NRHM. We called as Village Health Sanitation Nutrition Committee. Okay, every village they should have. That committee is involved in village health planning. Okay, it is an example for primary care approach. A village health sanitation and nutrition committee. So under NRHM it's there, and that's village health planning, and they will celebrate village health days. They will celebrate. Type of growth chart used by Anganwadi workers. And Anganwadi, we use this WHO growth charts. Okay, it is based on this MGRS standards, multi-centric growth reference study standards. Okay, this is based on these standards, multi-centric growth reference study standards. We use weight for age. Okay, we use weight for age. Use weight for age here. So MGRS, what is the name of the weighing scale? Okay, so weight is calculated in Anganwadis. This is called as Salter's weighing scale. Okay, so Salter's weighing scale. When will the birth weight will be doubled, and when will the birth height will be doubled? Okay, weight doubles in 5 months. What about height? Anyone? Can you tell me when will the birth height will be doubled? Yes. Forensic could have been taught. Yes. Weight doubles in 5 months. Height. Height doubles in anyone. Yes. Height doubles in 4 years, guys. 4 years. At birth, it's 50 centimeter. To reach 100 centimeter, it takes 4 years. So what are the indicators of malnutrition? Weight for age, we have weight for height. Both indicates acute malnutrition. Both indicates acute malnutrition. Weight for age and weight for height. Multiple times asked question. Okay, height for age. Height for age. The stunting. This indicates chronic malnutrition. Height for age, chronic malnutrition. Weight for height. Weight for height is wasting. Okay, that indicates acute malnutrition. Acute malnutrition. Height for age, stunting, chronic malnutrition. Okay, fine. What is the SAM criteria, guys? I'm going at a pace so that in a small time we can cover maximum topics. What is SAM criteria? Severe acute malnutrition. Last exam this question was there. Height for age. Weight for height. Weight for height. Okay, less than 3 standard deviation. Negative side. Negative side. Less than 3 standard deviation or mid-arm circumference. This was the question that was asked. Mid-arm circumference. Okay, you are going to measure the 𝐒𝐂𝐈𝐀 tape will be there. 6 months to 5 years you can measure. Mid-arm circumference less than 11.5 centimeters. This indicates SAM child, severe acute malnutrition. The last exam, this was the question. July exam. This concept was asked as a question. Okay, fine. Anything less than 3 standard deviation means severe, guys. Whether weight for height or height for age, okay, less than 3 standard deviation. Okay, so weight for height and all acute. Height for age indicates chronic. Okay, 3 standard deviation is chronic. Most common cause of infant mortality in India. Okay, it is low birth weight. Low birth weight. Most common cause of infant mortality. Low birth weight is the most common cause for neonatal mortality, infant mortality under 5. For all this time, this is the most common cause. What is the formula for infant mortality? I think this was the last exam. This concept was asked. The infant mortality rate. What is the okay number of infant deaths? What is infant deaths? 0 to 1 year. 0 to 1 year. Denominator is live births multiplied by 1000. Live births multiplied by 1000. Infant mortality rate indicates what? This was asked in NEET exam. Infant mortality rate, okay, indicates what? Infant mortality rate indicates a health status of the community. A health status of the community. Health status. This was asked in NEET exam. Okay, and we have this perinatal mortality rate. Perinatal mortality rate. Thus, that indicates pregnancy wastage, guys. That indicates pregnancy wastage. Perinatal mortality rate indicates pregnancy wastage. So pregnancy wastage. Under 5 mortality rate indicates what it indicates. Indicates social development and well-being, guys. Now, what about MMR? MMR. If you take MMR, maternal mortality ratio. Okay, the most common cause is direct is postpartum hemorrhage. Indirect is anemia. Most common cause direct is postpartum hemorrhage. Indirect, what we have is called as anemia. Okay, anemia. What about late neonatal period and post neonatal period? What is the most common cause? Late neonatal, post neonatal. Late neonatal and post neonatal, yes, it is infections. First is diarrhea followed by pneumonia. Diarrhea followed by late neonatal as well as post neonatal period. So these are the points we should know regarding this MMR, okay, and other things. Now, what about this program, school health program? School health program. Okay. So, minimum 10 square feet space should be there. Last exam, this was asked. Okay, how much space should be there? There should be there 10 square feet space per student, and we should have 40 students in a class. We should have one urinal should be there for 60 students. We should have one latrine should be have for 100 students. 100 students. One latrine should be there for 100 students. And with the type of desk, what we should have is called as minus this. Recently, this was asked. Okay, so school health program, 10 square feet space should be 10 square feet space should be. What is this answer for this question? One of you can answer this. A man from Chhattisgarh presented with muscle weakness, leg spasm, pure motor weakness. Yes. Anyone, can you answer this question? One of you can do it. Yes, this symptoms is mostly neuroletharism. Neuroletharism. Neuroletharism happens because of the consumed dal called as kesari dal, contains a toxin called as BOA. What is BOA means? Beta oxalyl amino. This is the toxin that is present there. Beta oxalyl aminoalanine, that is the toxin that is present there. If you consume over the period of time, you can develop this neuroletharism. Patient cannot walk. The patient will start his latent stage, no stage, 1-6 stage, 2-6 stage. Finally, the patient will go for crawling. If you want to give prophylaxis, okay, which vitamin you can give? That is recently asked NEET exam question. So if you want to give prophylaxis, vitamin C prophylaxis, okay, especially poor people, they consume. Or you can go for a removal of toxin. Toxin can be removed. That is also another way. Recently asked question is vitamin A, vitamin C prophylaxis can be given. Aflatoxicosis. Okay, so aflatoxicosis happens because of Aspergillus flavus, Aspergillus parasitic. So basically, they will grow on infest groundnuts. This is aflatoxicosis. Second is ergotism. Okay, ergotisms. We have this bajra plant. They will come and infest called as Claviceps purpurea. Okay, that will go on infest the field itself. They will infest, and so what you can do is that how will you remove the infested grains? By floating in 20% of salt water. So if you put this, that was few years back, that was a question. If you put this 20% salt water, if you put this grains, infested grains, we can remove it. Endemic ascites happens because of pyrrolizidine alkaloids. Okay, pyrrolizidine alkaloids. And what about epidemic dropsy? Epidemic dropsy happens because the mustard oil is contaminated, adulterated with organamone oil, contains a toxin called as sanguinary. Okay, the patient will have this, they will have this diarrhea, they will have this pedal edema, cardiac failure, dyspnea, glaucoma, they will have. Okay, this epidemic dropsy, sanguinary. What is the test available to know the contamination? The test available are nitric acid test. Second, what you can use is paper chromatography. Nitric acid as well as paper chromatography you can use. So nutrition wise, okay, what is the nutrient? What is the disease? Vitamin C, vitamin A. Vitamin A can cause what? Okay, it can cause what? Night blindness. Okay, bite out spots. It can cause bite out spots. That can also ask as image based question. So what is the treatment? Treatment is 0, 1 and 14 days. So you have to provide 3 days treatment. Earliest symptom is night blindness. Earliest sign is conjunctival xerosis. Okay, 3 days you have to provide. What about vitamin D? Vitamin D in adults, children, it can cause rickets. It can cause rickets. In adults, it can cause osteomalacia. Vitamin C. Okay, what about vitamin C? Vitamin C causes scurvy, guys. Okay, the richest source of vitamin C is in amla. It can cause scurvy. It can cause patient will have this delayed wound healing, bleeding gums. They will have thiamine. Thiamine can cause deficiency, can cause beriberi, and vernix encephalopathy. NEET exam. This was asked. Okay, patient will have ophthalmoplegia, double vision. Okay, chronic alcoholic cities, mental confusion, okay, ophthalmoplegia. Okay. So they will have these. That is vernix encephalopathy. Riboflavin, what they can have is angular stomatitis. Angular stomatitis. Niacin, it can cause pellagra. Common in maize eating people. Maize eating people, it is common. So they can have these features. What are the features? Okay, 4Ds. Okay, so diarrhea, dementia, dermatitis. Okay, you have this Castle's necklace. Dermatitis they will have. A Castle's necklace in the neck, it will be there. Okay, Castle's necklace. Folic acid deficiency. Folic acid deficiency can cause megaloblastic anemia. Vitamin B12 you will see only in animal foods. Patient will have pernicious anemia. Pernicious anemia. These are some of the nutrients along with the disease we can see. What about iodine? Okay, iodine deficiency in children, it can cause cretinism. In children, it can cause cretinism. So that's why we are forced to iodized oil. Iodized oil, not iodized salt actually, not oil. We don't use oil much. Iodized salt. Iodized salt, 30 ppm should be there in the salt, but production level. How much iodine should be there? 30 ppm should be there, and 15 ppm should be there at consumer level. 30 ppm at production level, 15 ppm should be there consumer level. Okay, and fluorine. Okay, what about fluorine? Fluorine is considered as a double-edged sword. So if it is more than 1.5 milligram per liter, okay, it can cause dental fluorosis. Okay, upper incisors will be affected. Okay, then more than 3 to 6 means it can cause skeletal fluorosis. And to reduce fluorosis, what is the name of the technique we use? Yes, to remove the excess fluorine, use a technique called as Nalgonda technique. To remove the excess fluorine, we use a technique called as Nalgonda technique we use. What about proteins, guys? Protein, what is the daily requirement? Recently asked in your exam, what is the daily requirement? So the daily requirement is 0.83 gram per kg. So we have this 0.83. 0.83 grams is required. Okay, protein is required per kg. This is the RDA, recommended daily. Okay, fat. What about fat? We have this essential fatty acids are there. Okay, so fat or nothing much. So, but I will see that pregnancy, how much extra calories required. Plus 350 calories during pregnancy. First 6 months of lactation, plus 600 calories. This is lactation, right? Lactation. Second 6 months it is plus 520 calories. So the amount of calorie, extra calorie required during pregnancy and lactation. What is this question? Can anyone answer this? Person with low blood pressure. Okay, yes. So this concept is called as tracking. NEET exam question. So people with low blood pressure, okay, so low blood pressure, they tend to have low BP, even in adults also. Okay, low blood pressure. People with high blood pressure, children, in adult, they will also develop high blood pressure. This concept is called as tracking. The tracking says that identifying children at risk of hypertension in future date. So if you are seeing a child like this, you can start preventive measure. You can start preventive measure. This is called as tracking. Tracking. We call this as tracking. What is the rule of halves? Last exam this was also asked. Rule of halves. Look at the picture. Latest exam. So this is also used for hypertension. Both condition used for hypertension. Hypertension is a highly asymptomatic disease. So patient most of the time they will not have any symptoms. So if there are 50 hypertensives are there, means 100 hypertensives. Out of them only 50% will know they are having hypertension. Among them 50% will be on treatment. Among them 50% will be adequately treated. This concept was called as rule of halves. Okay. Only 50% will know that they are having hypertension. Among them 50% will be on treatment. Among them 50% will be on adequate treatment. In your last exam, this was asked. Who is this FP? It is adequately treated. This concept was asked. This is rule of halves. This concept is rule of halves. For hypertension, we used one diet called as DASH diet. Dietary approaches to stop hypertension. A DASH diet, dietary approach to stop hypertension. The diet should be rich in proteins, low dairy products. Fruits and vegetables should be high. Okay, low saturated fat should be. Fourth terminology. What is the steps? This is a survey of WHO NCD risk factor survey. Survey includes first step physical measure, first step questionnaire regarding risk factors. Step 2 physical measurement like height, weight, BMI, and all. Step 3 biochemical measurements like FBS, cholesterol. So this was also asked, I think, in last or recent exam. This concept or step was asked. First step you ask whether smoking, alcohol is there or not. Second step you are going to do physical measurement. Third step you can do is second step blood pressure monitoring. Third step you can do is fasting blood sugar, cholesterol, biochemical measurements you can. When people are screened, this next chapter is called screening. When people are screened for others' benefit, what is it called as? So this is called as prospective screen. Example is immigrant screen. You are being screened for others' benefit. That is called as prospective screen. Okay, when people are from other countries are entering into India, okay, they will be checked for certain things. That is prospective screen. Okay, what is prescriptive screen? Screening for their benefit. You are screening people for their benefit. That is called as prescriptive screening. Example is pap smear. You are screening people for pap smear for whose benefit? Okay, that concerned person's benefit you are doing. This is called as pap smear. This is an example for prescriptive screening. Screening for others' benefit. Okay, that is called as prospective screening. What is lead time means what? Lead time. What do you mean by lead time? Lead time means time between first you are going to do screening, in the time between the first possible point and usual time of diagnosis. Usual time of diagnosis means we are going to use diagnostic test. Okay, screening test means time between the first possible point and usual time of diagnosis. Lead time. Second, what is sensitivity? The screening topic we are looking at sensitivity. Sensitivity means ability of the test to identify true positive is diseased people. So you are doing a test, to ability of the test to identify diseased people, that is sensitive. What is specificity? Specificity is that ability of the test to identify true negative. Suppose sensitivity 90% means what? 100 diseased people are there. If you do the screening test, it can able to identify 90 people. That is sensitive. The ability of the test to identify true positive. True positive means diseased people. Specificity means ability of the test to identify true negatives. True negative means non-diseased people. Can you answer this question, guys? Okay, one of you can answer. Yes. Extended sickness benefit for tuberculosis under ESI is. चलो, can answer it, guys. Answer कर सकता है, कोशिश करो. Okay, come back to this. Under ESI, medical benefit is given for family also. Worker got sick, you will get. When family के लिए भी okay medical benefit मिल सकता है. Sickness benefit 70% wages is given for 91 days. Sickness benefit. Okay, the person sickness के लिए 70% wages मिल सकते हैं 91 days के लिए. Extended sickness benefit 80% wages for 2 years. 2 years दे सकता है. And enhanced sickness benefit. Okay, vasectomy 7 days. So if you are undergoing tuberculomy, again 14 days. So 100% wages is given. 100% wages, vasectomy, tuberculomy. So maternity benefit, delivery, for delivery we will be providing 26 weeks. Okay, 100% wages. 100% wages. Any complication arises, another 4 more weeks is given, 100% wages. Temporary disablement benefit is there. Okay, 90% till recovery. Till recovery. And funeral benefit is 15,000 rupees. Somebody died, worker died. For them, okay, 15,000 rupees is given as a funeral benefit. Now you go back to the question and answer. What is the question? TB. TB is a chronic condition or TB. So we will go for 2 years days. Extended sickness benefit. Sickness benefit is for 91 days. The question themselves are given extended sickness benefit 80% wages for 2 years. What about Factories Act? The space say that minimum working space should be 500 cubic feet space. Safety officers should be there for every 1,000 workers. There are certain norms. Welfare officers should be there for every 500 workers. One welfare officer. Canteen should be there for every 250 workers. 𝐒𝐿𝐶. 𝐒𝐿𝐶 means child playing area. Child playing area, 𝐒𝐿𝐶. What about age limit? Below this age limit, that you should not work in factories. Come on, guys. Okay, you can put some answers. The age limit क्या है? Okay, so they should be banned less than what? Less than 14 years. Maximum working hours. Maximum working hours is per week is 48 hours per week. They ask you overtime. Overtime means it is 60 hours. 60 hours per week. Maximum working hours is 48 hours, including overtime means it's 60 hours. Now, in a management, next question, guys. Management technique. Management, which is more promising tool? So we have this two terminologies are the cost benefit analysis. You are comparing the cost with the economic benefit. I have put this much money. How much money you will get in medical field? That this is not suitable, guys. This is not suitable for medical field. This is not suitable. Cost effective is the cost you compare with the effectiveness in terms of disease deaths prevented. Disease and deaths prevented. This is more suitable for health field. The answer for this question is okay. So for health field ke liye, so how many we don't, our outcome will not come in terms of disease, sorry, in terms of money. For example, TB program is there, okay, HIV program is there. This one is more cost effective analysis. This one is more useful. Which international health agency contributed to applied nutrition program of India? Okay, so this is a neat question. This was asked, but it is also can be asked in FMGE exam. So the answer is UNICEF, guys. UNICEF program contributed to this applied nutrition program of India, okay, by providing manure and seeds. How they contributed? By providing manure and seeds. 1960s, okay, they helped us right now. So what are the agency? Okay, 𝐿𝐵FF. Okay, it's a growth monitoring, ORS, breastfeeding, immunization, this food fortification, family spacing, the female education. This is by UNICEF, guys. 𝐿𝐵FF. This is by UNICEF. Cobalt plant development. Okay, yes, this is recently asked question. Okay, NEET exam. This is Colombo plant. Okay, Colombo plant contributed to cobalt plant development in India. Construction of toilets in rural areas. Last exam question. This is Ford Foundation. Ford Foundation. Okay, so rural area they constructed, helped in plan construction of toilets. Blindness control program. Blindness is DANIDA. This is the International Health Agency, DANIDA. Okay, it's a Denmark agency that contributed. TB control program in India. This is given by SIDA. This is Swedish International Agency. They contribute. What about World Health Day? World Health Day is we celebrated on which day? The World Health Day. Okay, so we celebrate on 7th of April every year. What is the theme for this year? The theme for this year is Health for All. 75th year. So Health for All. So its headquarters located in Geneva. Control of 𝐒𝐿𝐶𝐝 presidency, 𝐒𝐿𝐶𝐝 infection Madras presidency. This is Rockefeller Foundation. This is Rockefeller Foundation. Control of 𝐒𝐿𝐶𝐝 infection Madras presidency, Rockefeller Foundation. So these are the various health agencies. They contributed various activities in India. What is the minimum recommended dose of free residual chlorine? Look here. So we have this chlorine demand. Chlorine demand is measured by 𝐸𝑟𝑥 apparatus. 𝐸𝑟𝑥 apparatus. So then you will add chlorine to the water. So what should be the minimum contact period? Minimum contact period should be 1 hour. 1 hour should be minimum contact. The residual chlorine should be 0.5 milligram per liter. That is not deciliter. 0.5 milligram per liter. The minimum residual chlorine. What is the name of the test to know whether the water is chlorinated or not? The test what we use is called as orthotoluidine test. Orthotoluidine arsenite test. These are the tests that is available to check whether the water is chlorinated or not. Orthotoluidine, orthotoluidine arsenite test. Arsenite test. Image based questions also there's there. I think 2 to 3. Okay, those are simple images, guys. Okay, this is propagated. What is this? Epidemic was there. Okay, fine. What is the difference between slow sand and rapid sand filters? We're trying to cover as much possible. Slow sand filters, this we use in rural areas. It occupies large space. Large space. There is one layer will be formed. It's called as 𝐒𝐿𝐶. This is the layer that cleans the water. 𝐒𝐿𝐶. And cleaning is done by scrapping. Manually you will be doing scrapping of it. Scrapping. It occupies large area, guys. Large area. The layer that is formed is called as 𝐒𝐿𝐶. Rapid sand filters. So rapid sand filters, what we have is urban areas we use. Urban areas. Chemical pre-treatment we do. Chemical pre-treatment. Okay, that water will be mixed with alum. We will mix it. And it occupies less space, and cleaning is done by how the cleaning will be done. Cleaning is done by backwashing, changing the direction of water. Backwashing, that's how we can do. Cleaning is done. So drinking water, how much should be the residual chlorine? Okay, that is 0.5 milligram. If it is for swimming pool, it should be 1 milligram per liter. Chlorine. Okay, chlorine level should be 1 milligram per liter for swimming pool. Air pollutants, we have the most important air pollutant is SO2. Okay, best indicator is SO2. Sulfur dioxide is the best indicator. Okay, followed by smoke, suspended particle. Smoke and suspended particles. How will you measure the cooling power of air? Cooling power of air is measured by Carter's thermometer. Cooling power of air means air temperature, air velocity, okay, and humidity. All three joined together, they form the cooling power of air. So what is the other use of Carter's thermometer? It measures low air velocity. It also measures low air velocity. Low air velocity is measured. Okay, fine. What about noise? Okay, so what is the maximum acceptable noise? Acceptable noise is 85 decibels. 85 decibels acceptable. Okay, at 90 decibels and all, you will develop auditory fatigability. You will develop. What about solid waste management? So we have this most insanitary method. Insanitary method is dumping. Dumping. Most sanitary method, okay, solid waste disposal is a controlled tipping. Most sanitary method, controlled tipping. That is the most sanitary method. Recently in an exam that was asked, okay, what about camps? How will you do in camps? Camps and all solid waste is by deep burial. You can go for deep burial. What is sewage and what is sullage? Sewage means, okay, waste water with excreta. Sullage, what is sullage? Sullage means waste water without excreta. There is no excreta. That is sullage. So you have this. We have this BOD, biological oxygen demand, suspended solids. Okay, both measure the strength of sewage. They measure the strength of sewage. They will measure biological oxygen demand and suspended solids. They measure the strength of sewage. COD, chemical oxygen demand, they measures the organic load in the sewage. Organic load in sewage. It measures the organic load. These are some of the points related with the environment chapter. We try to cover more topics here. I'm not sticking on to some areas. Biostatistics, nothing much here. So look here. So there is outliers are there. Okay. So what will you use? Okay, whenever there is an outlier in the data, outlier or extreme value, we should go for median. What is median? Means middle value. Median means middle value. Whenever there is an extreme value in the data, means it is we should go for median. Okay, what is this arithmetic mean? Arithmetic mean means average, guys. Average. Okay, so don't use mean whenever there is extreme value in the data. So go for median. What is mode means? Worst. Mode means most repeated value in the data. Mode means most repeated value in the. So if you arrange in either median means arrange the data in ascending or descending order, the middlemost value. Okay, fine. Now, so properties of normal distribution curve. What I want to remember is normal curve. Okay, area for the curve is 1. Mean, median, mode, all are same. Mean plus or minus 1 standard deviation corresponds to 68% of area. Mean plus or minus 2 standard deviation is 95% of area. Mean plus or minus 3 standard deviation is 99% of area. So this we call it as this normal distribution curve properties. multiple time asked topic. Okay, you can remember this. So 1 standard deviation, how much area? 2 means how much area? 3 means how much area? Some study designs we will see. Okay, what is this study design? Okay, fine. So 20 pregnant women were asked about history of smoking, and they came for regular antenatal visit and followed up. How many developed low birth weight? So it starts from exposure to outcome. If it goes from exposure to outcome, then it is called as prospective cohort study. Okay, so exposure to outcome. So what you can find here, you can find incidence, you can find relative risk, you can find attributable risk. It starts from exposure to outcome. So you divided mothers into pregnant mothers who are smokers, pregnant mothers who are non-smokers. You followed them over a period of time. This is what you can find. Famous cohort study. Famous cohort study is the Framingham heart study. Framingham heart. What about case control study? Case control study. It starts from outcome to exposure. Goes from outcome to exposure. Outcome to exposure. That is why it's called as a retrospective. Goes backwards. Okay, that is why it's called as a retrospective study. What you can find is odds ratio, also called as cross product. Okay, what you can find is odds ratio, also called as cross product ratio. This is outcome to exposure, case control study. Third one, let us see about RCT. RCT is which phase of clinical trial? Is phase 3 of clinical trial. RCT. In RCT, the most important terminology is randomization. Randomization. What is the randomization? Randomization, you are dividing people into two groups. Okay? Exposed people who will get drug A, people who will get drug B, like that. So randomization, what does it eliminate? It eliminates selection bias. It eliminates selection bias. This is about RCT. So in that we also have this single blind study. What is single blind study? Single blind trial. Single blind trial means patient does not know, okay, which treatment they belongs to, whether in treatment group or in control. Okay, what about double blind? Double blind trial means patient and doctor both does not know which group they are in. So triple blinding. What is triple blinding? Patient, doctor and analyzer, all three will not know who is the treatment group and who is the control. Okay, patient, doctor, analyzer. So best one is triple blinding. Most commonly used one is double blinding. Okay, most commonly double blinding. That is, patient and doctor will not know who is the treatment group and who is the control. Okay, fine. Incubation period for measles. Another commonly asked concepts. So measles, the answer here is, okay, anyone, can you put the answer here? Okay, yes, there is 10. Now look here, chicken pox incubation period is 14 to 16. Measles 10 to 14 days. Diphtheria 2 to 6. Influenza 1 to 4 days. Whooping cough and polio both are 7 to 14 days. The direct questions. Some numbers. Cholera is 1 to 5 days. Typhoid 10 to 14 days. Yellow fever 3 to 6 days. The quarantine period that is asked for yellow fever. Yellow fever, what is the strain we use for vaccine? 17D strain. Bubonic plague 2 to 7 days. So yellow fever, use the strain 17D strain. That is the quarantine period if they ask, that is 6 days. Chicken pox, what is characteristic of chicken pox rash? You'll have this pleomorphism. What is pleomorphism? All stages of rash you can find in the patient. Rheomorphism, macule, papule, pustule, everything you can find. So second is that, and patient can have this centripetal rash. Center of the body will be affected. Dewdrop appearance will be there. So superficial rash. So following we have the vaccine called as 𝐒𝐿 strain. So we should avoid salicylates following this strain. Otherwise it can cause Ray's syndrome. Ray's syndrome. Yeah, Ray's syndrome. Measles. What about measles? Measles, what you can get is 𝐒𝐿𝐄𝐝 spots. 𝐒𝐿𝐄𝐝 spots. Buccal mucosa, you will get bluish white lesions opposite to first or second lower molar tooth. Okay, it appears 1 to 2 days before the rash. So where the rash will start? So you will have this maculopapular rash. Where it will start? Maculopapular rash, they will start behind the ear. Behind the ear, retroauricular. I recently asked question. Maculopapular rash. Rubella, we have this congenital rubella syndrome, sensory neural hearing loss, cataract, and PDA. It's a common congenital anomalies you will get. So if the mother is exposed within the first 16, what is that? First 16 weeks of pregnancy. 16 to 20 weeks means deafness. More than 20 weeks means no. Diphtheria, what you can take? Okay, diphtheria, what you can get is membranous patch. Patient comes with membranous patch. Okay, plus bull neck appearance. The medical emergency. Bull neck means lymph nodes will be enlarged here. Lymph nodes will be enlarged. The bull neck appearance will be. So as a medical emergency, treatment is penicillin plus you have to provide antitoxin. Plus antitoxin. These are the points you should know regarding diphtheria. Penicillin plus antitoxin. So for carriers are the most important source of diphtheria. You can give what you can give. Yes, you can give carriers. Erythromycin we can. The following signs and symptoms included in syndromic approach of STD. So we follow these STDs. For this STDs treatment, we have a clinic. STD clinic is renamed as Suraksha Clinic. Suraksha Clinic, and we are using an approach called as syndromic approach. Syndromic approach. Syndromic approach. So what we do in this syndromic approach, that means a patient comes with a particular STD syndromes, just give the kit to them. Okay, colored kit you can give. What are the syndromes available? Okay, first is urethral discharge or anorectal. If it is there, you can give gray color kit. Vaginal discharge, NEET exam, this was asked. You can give the green color kit. Green color. This is kits, guys. This is kit. Okay, drugs will be there in it. Okay, gray color, green color. Non-herpetic GUD. Okay, this you can give a white color kit. This patient is penicillin allergic. Patient is penicillin allergic. You can GUD means genital ulcer disease. Okay, this is blue color kit. This is herpetic GUD, red color kit. Lower abdominal pain, it's yellow color kit, and inguinal buboes, you can have is black color kit. Black color. This we got. I think you have recently also we had a question. This for NEET exam as well as FMGE exam. Okay, so this is what is this? STD, sexually transmitted disease, and we have these kits available. It's fine. Blue color kit, okay, black, okay. So red, okay. So you have to know which one. So what is the answer for this question? Genital ulcer is the urethral discharge, vaginal discharge. Answer is dysuria in women. Answer is dysuria in women. Regarding leprosy, leprosy is one of the diseases we actually eliminated. So the criteria for elimination for leprosy in India is less than 1 case per 10,000 population. India has achieved this criteria in 2005, and it's in this stage. So for clinically only we are going to diagnose leprosy. One is paucibacillary, second is multibacillary. 5 or less than 5 lesions, paucibacillary, and 6 or more than 6 lesions means multibacillary. So here we are going to provide rifampicin monthly treatment. R means rifampicin, D means dapsone day. Multibacillary, here we are going to provide treatment is for here we have rifampicin monthly, D means dapsone daily. And we have C, clofazimine also daily. So RDC, okay, rifampicin, dapsone and clofazimine. So this is also daily. So the treatment is for 6 months. Okay, possibacillary and multibacillary for 12 months. So multibacillary, this is for 12 months. Okay. Will it be enough? Okay, we are trying to cover in 2 hours, guys. Much as recent question paper I gone through. So based on that, what is recently asked, based on this session I have prepared. Cannot say it's okay. At least quickly you can go through it. Okay, notes anyway will sending to you in the group, Telegram group. You can quickly go through it. Okay, fine. This is possibacillary. This is multibacillary, and we have this for these people. We have for TB. We have this NExT online portal for TB. So for this one we have NExT. We have A for leprosy online portal. For TB we have this. Yes. There is never enough. Keep improving every day. Yes, yes. This is a passing exam, guys. This is a passing exam. Actually, if you plan properly, you can clear the exam. Not so difficult. So for NExT, we have this NExT portion. Yojana is there, and we have this TB. So 99 dots. 99 dots for treatment monitoring. Okay, for TB treatment monitoring, we do this 99 dots. And for TB, what is the main method of diagnosis? We have this TB is that you take sputum, then you should go for AFP, okay? And next AFP stain, acid fast bacillus staining, chest X-ray. If there is a doubt, means what is the test you will go for? Go for CB-NAT, cartridge based nucleic acid amplification test. This was recently asked. If CB-NAT, if you are using for HIV person and all, directly HIV person directly do CB-NAT. Don't waste your time on acid fast bacillus and all. Directly you can do CB-NAT directly. That was recently. Okay. And HIV is that in HIV person, first you should start ATT. HIV TB positive means ATT first, then ART. If you do it wrongly, it can go for this IRIS. What is IRIS means what? Immune reconstitution inflammatory syndrome. So this is some outline, guys. This is some outline I have given you over a period of this 2 hours. Okay. So hope you learned something from this. Okay, these are our PW MedEd channel. Tomorrow we have microbiology session, then we have medicine, so psychiatry, pathology, like that it goes. Okay, hope this session was useful. Okay, so I'll send this PDF the Telegram channel. Okay, so concerned people will pass it on to you. Okay, I hope you study well. Okay, so all the best, guys. Okay, this is the last time. Okay, so don't lose hope. So you have to clear the get the magic number of 150 that you will get. Okay, study well. All the best, guys. Thank you. Any queries you can put it in the chat. Okay, I can answer. Otherwise, it's thank you, guys. Thanks for listening.